talk to you about tooth pain. A lot of times my patients will tell me right after they get their appliance that their whole mouth is kind of sore and achy, and it just generally is a little bit uncomfortable. The appliance itself is kind of like when you get braces and the teeth are just kind of being held into a spot that they haven't been used to being held into before. So usually with general tooth pain, all of your teeth on a kind of a 0 out of a 10 scale, about a 2 or a 3, it would be relatively common. And that should go away within a week or 2 of wearing the appliance and not typically return. Now, if you tell me there's one tooth that's really killing me and I really am uncomfortable with this part, then in that situation, it would be something where I would want you to come into the office so that I can make a little adjustment to the appliance and see if we can make it a better fit for you. Sometimes people will call me and they've been wearing a dental device for a long time, months to years, and then they start to develop pain on their tooth. Usually in these situations, we're gonna see maybe some aggravation while the appliance is in your mouth, but mostly it's going to be pain to function when you're chewing with hot or cold temperatures, or tender to touch in the area, or even some swelling in your mouth. And typically that's a dental related problem that is not because of the dental device. Either you have a tooth that has a crack in it, or has a new cavity or an infection in the roots that needs to be looked at. So in those situations, I would encourage you to go to your dentist and have them take x-rays and take a look and see what's happening so that they can get you out of pain that way. But again, typically not caused by the device itself, but something somewhat unrelated. Now, I'm always happy to take a look in my office if we need to make any sort of adjustments to the appliance, or if you just have some concern around something in your mouth that's not feeling quite right. It also could be sore on your mouth from a scratch or a scrape or a cut. In those situations, it's not going to be on the tooth, but more along with the gums and the cheeks or the sides of the tongue. Usually those little canker sore type ulcers go away in about 10 days. My best recommendation for those is you can get an over-the-counter Ambisol type of cream, like a topical jelly that you get from the drugstore, or really the best is just a warm saltwater rinse that you do twice a day, in addition to over-the-counter painkillers if it's uncomfortable, and hopefully that should take care of it. If you have any other questions for me though, please just give us a call and we're happy to help you out.